She found the dog standing over the crib, and her blood went cold. That is not a metaphor. Angela Morrison felt the temperature drop in her extremities, fingertips first, then palms, then the crawling numbness up her forearms. As she stood in the doorway of her son's nursery at 1:17 in the morning and processed what she was seeing. Duke, their 3-year-old Saint Bernard, was standing with his front paws on the nursery floor and his chest pressed against the crib rail. His head was inside the crib. His mouth was open. His teeth were 6 inches from 9-month-old Lucas's face. Angela did not scream. She did not breathe. She crossed the room in 3 steps and grabbed Duke's collar with both hands, yanking him backward with a force that surprised both of them. Duke's nails scratched the hardwood as he slid. He did not resist, but he did not look away from the crib. Lucas was awake. His eyes were open, but he was not crying. He was not moving. He was lying on his back, perfectly still, staring at the ceiling with an expression Angela had never seen on a 9-month-old face. She picked him up. He was limp, not the soft limpness of a sleepy baby, but the boneless limpness of a body that was not entirely present. His skin was cool. His breathing was shallow, each inhale barely lifting his chest. "Mark!" Her voice cracked on the consonant. "Mark!" Her husband appeared in the hallway in boxer shorts, squinting against the light. Angela was already moving toward him, Lucas in her arms, Duke following 3 steps behind, despite Angela's collar yank. Something's wrong with him. He's not responding. Mark took Lucas. The baby's head lolled against his father's shoulder. His eyes were open but unfocused, tracking nothing, fixed on a middle distance that did not exist. They drove to St. Mary's emergency room at 1:29 a.m. Mark drove. Angela held Lucas in the back seat, monitoring his breathing with her hand on his chest, counting each rise. 14 per minute. She knew from her nursing training that a 9-month-old should be between 25 and 40. 14 was not enough. The triage nurse took Lucas's oxygen saturation, 87%. Normal is 95 to 100. Below 90 triggers an immediate response. Below 85 is critical. They were in a treatment room in 4 minutes. Dr. Alan Jeffries, the attending pediatrician, assessed Lucas with the efficient calm of someone who has done this calculation 1,000 times. He ordered a blood gas panel, a chest X-ray, and continuous pulse oximetry. The blood gas came back first. Lucas's carbon dioxide level was 62 millimeters of mercury. Normal is 35 to 45. Above 50 is respiratory failure. Your son's central breathing drive has been suppressed. Doctor, Jeffries said, and he said it in the way doctors say things when they need you to understand immediately. His brain is not telling his lungs to breathe deeply enough. We need to find out why. The MRI was scheduled for 5:45 a.m. Angela sat in the waiting room and did not close her eyes. At some point she remembered Duke, alone in the house, probably still standing at the empty crib. She called her neighbor. "Can you let the dog out? We're at the hospital. Is Lucas okay?" Jeffries had suspected a Chiari malformation, a structural defect where the lower part of the brain pushes through the opening at the base of the skull, compressing the brainstem. In Lucas's case, the compression was affecting the respiratory center, gradually reducing the depth and rate of his breathing, particularly during sleep. This has been developing for weeks, possibly months, Dr. Jeffries said. During the day, when he's active and awake, the voluntary breathing pathways compensate. But during sleep, when breathing is entirely controlled by the brainstem, the compression reduces the signal. His breathing has been getting shallower at night for some time. Angela thought about Duke, standing at the crib, mouth open near Lucas's face. "Doctor, our dog has been going to the crib at night. For about 2 weeks. We thought he was being possessive. We were about to. We were talking about rehoming him. Was the dog's mouth near the baby's face? Yes. Was he breathing on the baby? Angela blinked. She replayed the image. Duke's head inside the crib, his mouth open, positioned inches from Lucas's face. Not biting, not licking, breathing. Yes. She whispered. Dr. Jeffries was quiet for a moment. There's documented behavior in some breeds, particularly large breeds with strong bonding instincts, where the dog will position its face near a compromised infant and exhale deliberately. The warm carbon dioxide-rich air acts as a mild respiratory stimulant. It's the same principle behind why NICU nurses sometimes use gentle face stimulation to rouse apneic preemies. If this story moved you, subscribe. The next one will leave you speechless. Angela sat in the hospital chair and felt the full weight of what she had almost done. She had grabbed Duke by the collar. She had dragged him away. She had looked at what the dog was doing and seen a threat. The dog had been breathing for her son. Lucas underwent corrective surgery 3 days later. The decompression procedure relieved the pressure on his brainstem. Within 48 hours, his oxygen saturation stabilized at 97%. His breathing rate during sleep returned to normal. When they brought Lucas home, Duke was waiting at the front door, not jumping, not barking, standing. Angela set Lucas's carrier on the living room floor. Duke approached slowly, pressed his nose to the mesh window of the carrier, and inhaled once, a long, deliberate breath that expanded his entire chest. Then he exhaled. Then he lay down beside the carrier and closed his eyes. We share these stories because the world needs to see them. Subscribe to be part of that. Angela knelt on the floor beside him. She put her hand on his massive head, feeling the warmth of his skull, the slow pulse in his temple, the steady rhythm of his breathing. She leaned close to his ear. "I'm sorry," she said. "I didn't understand." Duke's tail moved once, a single slow sweep across the hardwood. He did not open his eyes. He did not need to. The next story involves a family who locked their dog out of the nursery every night, until the night they forgot.